So hip arthroscopy is a minimally invasive surgery using camera and long working utensils to address hip pathology in both young and old people who do not have severe degenerative changes of the hip but have debilitating hip pain. This pathology or problem with the hip ranges. It can be from the socket being too deep, or it could be from the ball of the femoral head not being completely round. It could be from the socket being too shallow. It could be from muscle and tendon issues or problems. All these can be addressed with arthroscopy of the hip. This is typically done through 3 or 2 poke holes in the thigh that are about 1 centimeter to 1.5 centimeters in length. This is done as an outpatient, so patients come in the morning. The surgery takes approximately 2 hours, and then they go home that evening, which is some outpatient pain control. There are many hip conditions that can be treated with hip arthroscopy, and there are also some that cannot be treated with hip arthroscopy. The main pathology we treat with hip arthroscopy is called hip impingement. The hip is a ball and socket joint, so you have a socket and a ball, and essentially as you come into flexion and internal rotation, if your socket is too deep or if your ball is a little not quite round but a little oval shaped, the bones can pinch, and they're pinching a gasket called the labrum that surrounds the hip and creates a suction seal. The suction seal is very important both for hip function and hip stability. Over time, this continued pinching can cause some degeneration or tearing of the cartilage or labrum. This can lead to hip pain and disability. So the advantage of hip arthroscopy is that it's minimally invasive, recovery time is faster, and we're now able to address types of pathology and return athletes to sports and patients we've not previously really been able to help.